This is Art, and in this video I will show you about the patient monitoring software, which is the simulator, and this is my second video about discussing about it. Now, when you first download the file from the internet, I will show you a link to download it. Once you've done downloading it, you'll find the file in your downloads folder, or you moved it to your desktop. When you open up this file folder, you will find these core components for the software to run, and even crucial. These are all of the configuration files and other files, which is important. With just a simple exe file, which is the main software, which inputs data onto the software to run. Now this is an exe file, which is that. With a simple obj, which stands for object, file folder with the images and the sounds. These are objects, acting like an object because of this name of the file folder. This happens, that's why there's nothing to worry about now. Now, when you first double click on this patient monitor app, it will ask you to extract the file. Click on extract all. Then you will click on extract. I've already extracted it already, as you can see here, but I'm getting this window, that's why I'm going to click on cancel. This window will come up, even if it's extracted. I'll close this both windows. Then you open up this file folder which or even I extracted. Then you can see here this view has been changed right now. When you first open this folder, just click on the patient monitor .exe file format, which is this, for the application to run. And this one will come up. You can resize to get better viewing of the measurements, especially if you are training a medical student. First, we are going to talk about the user interface of this software. This is a time and date. When you click on this window will come up. The bed 1, name, test patient, age, you can type in the age if you want to, but I'll leave it 22 for this tutorial. Diagnosis, no diagnosis because this is a demo simulator. Notes, you can type in the notes. For example, look, if we type in then this accepts that this is the main need for patient to get treatment. But keep in mind that this simulator can be also used for for your, even if you're a doctor, which I say is for your training, or even if it's still not possible, even you can use it in your hospital. You can even show this to your patients about how this works. Even if it's fake, you can still show this. And that's it. Now, the heart rate is 60 to 62 beats per minute, and the source is, which is highlighted in red box, EKG and pleth. And the SpO2, pulse rate, temperature as well is all part of the user interface, even with the wavelines, which is right here. Even with the buttons, and even with the structure, all of them are the user interface. Now we're done with the user interface. Now we're moving on to the interactions. When you press pause, it will pause the waveform. Look, you can see it pauses. Then to resume the software's waveform control, just click on resume or press pause again, I think. Then it will start to resume the waveform. If I pause them all, look, it pauses them all and they no longer move. And it's frozen. Now this is a waveform changer, and you can change the color to whichever color you like. For example, I like to have blue, back, and then it changes the color. I'll switch it to green again, backwards for this tutorial. But you can leave it as any color you want. But for this tutorial, I'll leave it as default for now. Now, one thing I cannot forget to show you is that you can enable the pleth. Look, this number changes and it's still 57, 54, 53 BPM for the pleth rate, and the EKG I'll show you is 61, and it's back to the green one. If I press on pleth, it changes to purple, and it changes to green when switch to EKG. Now, when I change an EKG regime, no, we're not. Yes, we will discuss about that later. You can also fill this graph. We will fill the graph, and it will show like this. Viewing. When you uncheck this, it will revert back to the normal. You can also show grid lines for a real EKG. This is found in most patient monitors, especially in fictional settings where this grid line is prevalent. But it can even be used for but if you are struggling to see the waveform and the information, you can always click on this and you can uncheck this, show grid lines. Click back and it will perfectly extend your viewing chances to look at the waveform, and it applies to every waveform that you wanted to see, even if you have difficulty seeing it and have no visual problems. Now, we are going to change this to SPO2. Change this graph to SPO2, confirm. Then it changes to the SPO2 rate. Look, the number is matching, and as well as the minimum minute 88 time and date is matching as well. Now to switch back to pleth, which is the default one, click on confirm and then switch back to pleth. Now the green and the pink lights are flashing. That means the pleth or even the SPO2, I don't know, I think that the pleth, and the green and the pink, the pleth and the EKG are flashing. That means it is measuring the pulse rate and the PR. We are going to change the color of the PR to a different color. We are going to change it to, I think that is going to be white. Or I can change this back to yellow. Next, in the preferences, in the preferences, we can check zones. And look, the EKG waveform is changing. The wave and the numbers are flashing and blinking, which is this dot. And if you mute this, look, the number is flashing. And when you go to views, you just click on views and it will give you two different views that you are going to be able to try. For example, that I prefer this view, then it means that I'm preferring this view because this is reliable for those who are having a small patient monitor, but a small patient monitor can even I'll show you, even have this view, but this applies to a bit larger patient monitors or even smaller patient monitors. But on a lot more, even more smaller one, this view is like this. And when you just go ahead and click on EKG, you will change this to EKG. Then if you want to change the EKG rhythm, then you will be able to adjust the time interval and the resolution interval. I'll show it. Well, I'm trying to change the EKG rhythm. Yes, this is sinus bradycardia, but the heart rate is still normal, but it's sinus bradycardia. Look, there is a large gap between the QRS complex, but it does not contain T wave, P wave, or the ST segment waves, which are crucial for EKG waves. because this waveform is different. Then if I'll show you next EKG rhythm. This is sinus no, yeah, this is this is, I think that this is ventricular tachycardia, or even supraventricular tachycardia without P waves, T waves, or other waves which are apart from the QRSs. I think, yes, this is like this. Now this is a fast heart rate, even if the heart rate is 63, 64, and it's lower, 62, other things like that. And even if I um uh, oh yes, this is like, this rhythm is called, I think that is called a small sized version of the ventricular. Yes, obviously. Oh, now I know it. It's not that. It is VFib or fine VFib, but I think that is fine VFib or even asystole. I think. And this is an agonal rhythm. No. Not an agonal rhythm. I forgot. This is another bradycardia, sinus bradycardia rhythm. And when they change this, I need to change. This is sinus tachycardia, and this is a rhythm, even if the EKG rhythm is normal, 65, 64, another rate which is normal, even with the sinus tachycardia effect of the waveform. And this is, no, this is not that. I'll show you. And this is the waveform. Looks like, yeah, this is asystole, another asystole. Now when we go to views, when you go back, you'll go back to the normal view. And to readjust the EKG rhythm, you will be able to change this back, and it's back to the EKG rhythm, normal sinus rhythm. And thank you, my name is Ali Hazard, and press the like button below. And thank you for watching my how do I change the EKG rhythm, which I discussed now in this video. Thank you for watching this video.